So this is her with her family.
On the last day of Risha Golby's life, she was forced out of her room at St. Paul's Hospital in Vancouver. That had become her home since she'd learned she had pancreatic cancer 6 weeks earlier. The 47-year-old mother was taken by ambulance to an outpatient facility and placed on a lazy boy recliner where her family said their final goodbyes. Moments later, she received medical assistance in dying and was gone.
And I remember just feeling devastated at the loss of my sister, but more than that, feeling confused and shocked that her last hours were allowed to go ahead like that.
St. Paul's is a Catholic hospital and does not allow MAID to be performed on its premises. Providence Health, which runs the facility, says it has a long-standing moral tradition of compassionate care that neither prolongs dying nor hastens it. The number of hospital beds controlled by faith-based facilities continues to grow across the country. Dying with Dignity Canada says there are more than 100 hospitals with about 13,000 beds. Alberta is currently in the process of acquiring 700 more Catholic beds in Edmonton.
A lot of cities, the faith-based hospital is the only game in town.
The organization is involved in a lawsuit in BC to change government policy so people can receive MAID at whatever hospital they may be in. Helen McCaffrey hopes they win.
It's cruel.
Her husband Jim was forced out of the Elizabeth Briere Hospital in Ottawa he had been in for 4 months in order to receive MAID. The ambulance was 2 hours late, and when they finally took the 87-year-old man to another facility, he was placed in an office to die. The ordeal was so traumatic that his wife says she needed therapy for 2 years to deal with the guilt.
And I'm sorry that it was so sad for him, that he should be treated really like a piece of garbage.
Briere Health says it's sorry to hear about what the McCaffreys went through. A spokesperson said it's not reflective of the experience we would want for anyone we care for. Families say they understand if individual doctors or nurses don't want to perform MAID, but they say publicly funded hospitals should not have more rights than patients. Caroline Bargu, CBC News, Vancouver.